Hey, it's Roberto Miki again, and we've got another question in our hand question of the week. It's number 17 in our series of questions for medical students, residents, and fellows studying for the in-training exam or for the boards. A 45-year-old female presents with a mass in the volar left ring finger. She reports a history of a puncture wound from a fish spine while unhooking a fish while fishing. What step is necessary during biopsy? A. Pathology specimen is unnecessary. B. Mycobacterial cultures at 30 degrees Celsius and 37 degrees Celsius. C. Fungal cultures using Lowenstein-Jensen agar. D. Frozen section of specimen is required. Or E. Aerobic and anaerobic cultures at 101.5 degrees Fahrenheit. Well, this is your chance to pause the video so you can answer the question yourself. Mycobacterium marinum is an organism which can infect humans who have a break in their skin and are exposed to an aquatic environment. Aquariums are a common source, and obviously fishermen have an occupational exposure. But anybody who you suspect has had an exposure and their skin has been broken, you should obtain a culture. When obtaining cultures, if there's a suspicion for Mycobacterium marinum, culture should be sent for the typical aerobic, anaerobic, fungal, and mycobacterial cultures. In addition to the normal 37 degrees Celsius for the mycobacterial culture, the culture also needs to be sent for a lower temperature setting between 28 degrees Celsius and 32 degrees Celsius. So when you order this test, you have to tell the laboratory to do the test at a lower temperature as well. The culture medium is still Lowenstein-Jensen agar. So the answer is B, mycobacterial cultures at 30 degrees Celsius and 37 degrees Celsius. Thanks for watching. Hope to see you at the next one. Please like and subscribe so we can continue to support this channel. Thank you.